Hi, Dr. Curtis here from Longview Spine and Sports Medicine. Today I want to share a little bit of information about the typical treatment cycle with somebody that has osteoarthritis in their knee. You wake up one morning and you feel something wrong with your knee. Nothing real bad, but you know that it's something that's not right. You get through the day a little bit, it starts to wear off and get better, and you go through this for a few weeks until one day you wake up and it's even hard to get out of bed. And you think something's not right. What is this? So you take a couple of anti-inflammatories. Makes it feel better. You get through the day, go on through work. A few weeks later, now the two Advil or the two anti-inflammatories aren't really doing the job. And now it's starting to be 4 of them. Or maybe it's four times a day because the pain continues on and continues on. And to me, that's like going to the dentist with a cavity and just getting something to rub on it or getting a shot. So what do we usually do? We ask our friends, we ask our family, what do they have in their medicine chest? It worked for them, maybe it'll work for me, because you don't want to go to the doctor. And a few weeks more of that, or maybe even a few months more of that, and now your knee is starting to bother you every day. Sometimes it even wakes you up at night, just turning over. We go to our family doctor because our spouse told us to. He says, well, let's do some x-rays. And we find out that you're getting to be bone on bone. You're losing all of the space in your knee. You have osteoarthritis. So what does he do? He prescribes you some stronger anti-inflammatories. And that goes on for a few weeks or a few months. But it's not getting any better. And you know it. And you're having a harder time walking. You're having a harder time at work. Maybe you're starting to wear that knee brace that you thought about getting over at the pharmacy. You take that for a few more weeks and you finally decide, I got to do something, and you go back. And he says, well, we can give you a cortisone injection. Well, has anyone heard you can only do 3 cortisone injections? And the reason is because they actually make the joint worse. They degrade the bone. I know it feels good, I understand, but they're not good for the joint. That lasts for a little while until a few weeks or months later, it starts bothering you again, and there you go back to the doctor. And this time he sends you to the specialist, which is an orthopedic surgeon. The orthopedic surgeon said, well, we better get an MRI. And the MRI starts showing, oh, now you've got torn meniscus, your ACL is half shredded, your ligaments on the sides are worn down, and you're starting to get bone on bone. Now you're scared. And what do? Well, we can get you some rooster comb injections. Rooster comb injections are hyaluronic acid, and they're temporary like WD-40. They just put more lubrication. Where do they get that? You know that red dangly thing on a rooster? They found that it's bioidentical to the fluid that's in your knee. So they put that in, but they have to tell you it really won't last for more than 6 months. All that is just buying time while it's continuing to wear down. So like going to the dentist and just getting that shot, eventually that's going to become a root canal, or you're going to have to pull that tooth. So the next part of this treatment cycle is after you've done the rooster comb, after you've done the cortisone injection, is we're going to have to do an arthroscopic surgery where they go in, one's got a little scissors on it, one's got a little camera, they go in through 3 little holes in your knee and they trim up anything that's in that joint space. It's a painful procedure and it's a painful rehab. After a while, here comes the pain again. Another 6 months you bought yourself, maybe even a year or 2. And now that you take an x-ray of it and it's really bone on bone. Now it's gotten so bad, there's nothing else left but to have surgery done. At our office, we would rather catch this early on. It's easier to fix a cavity than a root canal. We do regenerative medicine with stem cells that can heal, that can regenerate the cartilage and the bone in your knees and hopefully help you from not having to have a surgery. Thank you for listening.